Why long-term care for me? Really, it was an introduction through family experience, experiencing it from the public side of things that really ignited my passion for it. In acute care, it's really task-based and moving on to the next task quite quickly. In my experience, long-term care is taking it a step further and looking at patients as people and getting to know them on that emotional level. Another piece I've learned that shocks a lot of people about long-term care is it's for people 18 plus. Oftentimes we have people in their 30s, 40s, 50s, as well as seniors, and then you have the complex health histories and diverse cultures. It's just really learning how to marry all of those pieces together, and it's really fulfilling when it works out.
I came into LTC thinking that it was gonna be a stepping stone, but the longer I stayed in LTC, I realized that this is really a good place for me. With the 8-hour shifts, I have a good balance with my work and home. LTC is not inferior to acute. It has its own challenges. It has its own unique caseload. There's a different type of skills that nurses would learn being in LTC.
Bedside care for me is one thing that I really love. I can go up if I wanted to. I can be a supervisor, a leader or what, but then I prefer staying at bedside care because it helps me to connect with people. That's what I really love actually.
You treat everybody the same way, with compassion, with care, with excellence, with responsibility, with courage and confidence. So I feel like everybody should be on that kind of high standard of care to be given.
We do foster a very good team collaboration. Every day we have huddles where everybody in the interdisciplinary team can give their inputs on how to give a proper resident care. So that really fosters good teamwork and collaboration.
One thing I can say about this organization is they do recognize hard work and dedication and the opportunities to learn, the opportunities to be mentored by people, to reach out to people. What we are trying to do is to really build out a program giving frontline staff, whether that's nurses or allied health professionals, anyone really within our organization that has a desire to further their education and opportunities for leadership positions, whether that's a clinical nurse leader or an educator or manager. We really encourage people to reach out to us and ask those questions, and we do our best to bring them alongside and give them opportunities.
If you walk into any Providence Health Care setting, I'm sure you'll hear the term home for us. What that really looks at is making a care home just that, a home, making the living environment feel like a home. So if you walk in, there's no question of if you're in a hospital or someone's house, you know you're in a living room because it feels and looks that way. You know you're approaching someone's room, which is their home, because it looks and feels that way. My favorite concept is that home is a feeling, not a place. We're just getting started with a lot of changes in that direction, so it's just a very exciting time to be a part of it.
People that are here because they feel like they belong to something bigger. People are really proud to work for Providence, and they stay. We have staff that stick with us for like 30, 40 years. We really do try to encourage people to feel a part of something bigger, and we do really support our staff and residents. We want everyone to feel valued and appreciated.